Talk by Dr. S.K. Mishra. The next speaker, Dr. A.K. Jain, sir. Yes, you can please.
Here is. Good morning, everyone, and greetings from Army Hospital Research and Referral. So I shall be speaking on extended range of vision with LUXSMART pure refractive optics. I don't have any financial disclosure. So we all know what is the requirement of a patient after cataract surgery, that he wants now good distant vision, good intermediate vision, and a good near vision. So the distant vision for driving night activities, the intermediate vision for laptops and work on playing golf, and near vision definitely for readings. So the answer is one of the answers is EDOF lenses, where you get a good distant vision, intermediate vision, and a functional near vision. So the best candidates for these EDOF, that is LUXSMART lenses, that where you plan to do emmetropia. It's recommended that in LUXSMART you don't try a micro monovision like any other EDOF lenses. You plan for a emmetropia, where the patient, you plan for bilateral implantation if you have night drivers, photographers, and microscopic users. So what are the content where you should be careful is that the patient is very demanding. Please be very, very careful in demanding patients, because they have a lot of expectations, and none of the lenses can fulfill all their expectations. If you have a pre-operative astigmatism of more than 0.75, the option here is that one has to go for a toric lenses. We have toric LUXSMART lenses. If you have pre-existing corneal or retinal pathologies, if you have any intraoperative surgical complications or dry eyes, please avoid these lenses. So we know that how do you correct for presbyopia is either you can go for a micro monovision or go for bifocal, trifocal EDOF accommodative lenses or pinhole effects. So we know how it works, that it's an extended depth of focus, where it provides a range of vision rather than a single point of focus. So as by my previous speaker, it's already been given in detail what are the ENSI criteria for EDOF technology. Again, it gives basically it gives some degree of independence from glasses, giving a good intermediate vision and minimal impact on the distant vision. Gives a zone of vision rather than a single point of vision, and there is definitely a reduced halos and glare in these lenses, providing a sharp vision for the distance as well as intermediate vision. If you this in monofocal, this is the MTF of monofocal, bifocal, and EDOF lenses. EDOF lenses provide a good MTF for the intermediate vision, especially the LUXSMART. A brief on the LUXSMART lenses, that it's a different technology. That's a patented technology where it has got a center EDOF center, which is a 2 millimeter zone, and this is followed by a patented transition zone and a monofocal periphery. There are no rings in this. So the center part of these lenses, it uses the combination of 4th order and the 6th order spherical aberration of opposite sign, which increases the depth of focus by 118. That means it provides it's almost like 1.5 diopters of intermediate vision. There is a smooth transition of optic vergence from the center to the periphery, and this is how it attains the EDOF property of these lenses. So it's a monofocal, there's asphericity and aberration-free lenses, and it is a 4-point, that is, it's got a 4 haptics, so it's a 4-point fixation, and it's it comes in a preloaded form. It's a hydrophobic acrylic copolymer, including a UV absorbing material, which protects against the light that could cause a retinal damage. These are the properties of this LUXSMART lenses. The point of this 4-point fixation is that it prevents, it gives a stability against rotation, and especially when you're using a toric form of these lenses. Again, the advantages of preloaded lens, I don't have to mention in detail that it's easier, but I would, these are the videos, if you see this lenses, there are 2 different videos. So one it goes in a very smooth manner. But this is one, if you see this, the edges, this is a very smooth, the edges, if you delay this lenses in loading and implantation, you can have these edges which will stand out for some time. Don't be scared of these, because ultimately it's going to go back, but it takes little time. And so this is my word of caution in this, that you, unlike any other lens where you know, your assistant, the moment you have done your, before the phaco is done and the lens is loaded, here you should not do that. You should load the lens when you are absolutely ready for the lens implantation, and the lens injection should be done in one go. It cannot be any delay there. So it has to be smooth one. That's very, very important, because if you do that, if there is a delay, then you will have problems. So it's not a trifocal lens. So please do not say that patient is going to get rid of your glasses. It is going to give a functional near vision. And this is my data that I've implanted almost 148 these lenses. And in more than 95% of patients, I've achieved 6/6 distant vision, 6/6 intermediate vision in 95% of patients, and functional near vision. That is in almost 80% of the patient, the vision was N8. In 10% of the patient was N6, and 10% was N10 and beyond. This is the video which I was talking about, that the edges, you know, the optic edges, they tend to roll up a bit and takes little time for it to unfold. These, if you can see this, these are the edges, and this is how it takes little time for it to unfold. So the key advantage is that it gives a good distant visual acuity. There's a good intermediate visual acuity because of depth of focus, low dysphotopsia, tolerance to tilt and decentration, and a quick neural adaptation, increases the presbyopia management indication, and comes in a preloaded delivery system. Thank you.
Thank you so much, Dr. Mishra.
Dr. Mishra, I have one question.
Yeah, please.
You mentioned that the intermediate vision by this lens is about 95. About in your patient, it is 6/9. So you have drawn the defocus curve for these lenses, or
yes, sir.
How you assessed?
We have drawn a defocus lens. We have done. I didn't, because of the positive time. I have not given my this thing, but we have a defocus curve with this.
So that is how we confirm the performance of these
Yes,
lenses,
yes,
because
it does.
unless it is confirmed by the defocus curve,
Exactly.
it's very important
It does
to
with that.
plot the defocus curve for these lenses.
Thank you.